Hello and welcome to our daily COVID-19 update for the town of Plymouth. This is number 42. It's coming to you live on Monday, May 11, 2020 at 12 noon. I'm Steve Triffletti, your Plymouth Town Moderator, and we'll be here each day this week, Monday through Friday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us to plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Sarah Cloud. She's the Director of Behavioral Health and Social Work at Beth Israel Deaconess in Plymouth. Also, Dr. Russell Fry, he is a clinical psychologist. Barry DeBlasio, he's the Director of Community Resources for the town of Plymouth. And Bob Nolet is the Director of Operations for the Plymouth Area Chamber of Commerce. Each day we date stamp these forums in order that you'll know when this is coming to you live. And at this time, we're going to begin with the Chair of the Plymouth Board of Selectmen, Ken Tavares. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. It's a pleasure to be here once again. I have a message from our town clerk that he wanted me to bring to everyone today, and that is 3 simple words: vote by mail. Mr. Pizer is encouraging everyone to vote by mail. It's not too late. The election is a week from tomorrow, May 19th, for the Senate vacancy. So please, if you have any questions, Mr. Pizer said, do not hesitate. Give him a call at 508-322-3302. Again, I'll repeat that, 508-322-3302. He will answer any questions that you may have about getting a ballot before the election. We know that this is going to be a difficult election because there'll be so many changes, but he feels that working together, we'll all be able to get to the polls. And he does recommend doing it by mail. Also, if anyone is interested, if you've never done it before and you'd like to work at the polls, please call Mr. Pizer. He's looking for volunteers, actually volunteers that are paid, if you are interested in working at the polls. Also, I'd like to give a shout out to the Chamber. This past weekend, the fundraiser that they had for the Plymouth One Fund was phenomenal. The talent in this community was wonderful to watch. 3.5 hours of great entertainment. Good pieces were presented by business owners. And thank you to everyone in the chamber for the work that they did, along with PAC TV. You're all successful. We're just afraid of losing you to a New York TV station. Also, I'd like to announce that I've asked through the moderator, I've asked the Director of Assessing to come in next week to talk about various programs that are available to taxpayers. Ann Dunn will be here next week, and we'll have the opportunity to do this in a great deal of detail. So stay tuned for that next week. Thank you, Steve.
Thank you. That's Kenneth Tavares. He's the Chair of the Plymouth Board of Selectmen. Each Monday, we welcome in our health segment Sarah Cloud. She's the Director of Behavioral Health and Social Work, Beth Israel Deaconess, Plymouth Campus. Welcome, Sarah.
Thank you. Happy Monday to all. As we turn our attention towards recovery and opening businesses, I think it'd be really helpful if we could stop and really consider what our expectations are. An expectation, in the simplest of terms, is a thought about the way that we want or think something should be. So expectations can range from an obvious form as I really want to go out and have dinner at the restaurant, to a more subtle expression or thoughts such as I just assumed that we would get back in line just like we did last year when the ice cream shops reopened for the season. So regardless of what form an expectation takes, it brings in a judgment that we're often not even aware that we're making about the way we think the world should be. So the challenge in all of that is when our reality or our experience doesn't match what our expectations are. Which, and much of the time, as I said, we're not even aware that we have these expectations or these thoughts in our head. And it can really lead to dissatisfaction, irritation, frustration, and even anger. And all of those things are very unpleasant to experience and unfortunately often lead to, if we're not really careful, behaviors that are harmful to others, such as yelling at an essential worker at a grocery store, or it's harmful to our relationships, such as arguing with our significant others at home. So I just would like to urge everybody to pause and to take inventory about their expectations and the thoughts that they have in these really new and unusual times. As much as we want to, we're not going to resume and pick up where we left off prior to the pandemic. Things are going to be different. And I'd really like to challenge everyone, and myself as included in this, to really reflect on what we're expecting as things begin to reopen a week from today. And if we are able to challenge our expectations and set really reasonable ones, such as things will be different and we're going to get through this together, we'll figure it out. We're both going to feel better and we're going to be a lot kinder to both ourselves and others. So it's just helpful to remind ourselves that we're all doing the best that we can under these current circumstances. Thank you.
Thanks. That's Sarah Cloud. She's the Director of Behavioral Health and Social Work. Beth Israel, Deaconess. She and all of our participants will be here today to answer your questions. Email us at plymouthinfo@pactv.org. And at this time, we welcome back Dr. Russell Fry. He's a clinical psychologist in Plymouth. Welcome, Russ.
Thank you, Steve, and thank you, people listening in. My theme for today, and I want to link in with what Sarah's talking about, our expectations. But the theme is for today is not doing nothing is harder than doing something hard. So we've been asked to quarantine and remove ourselves from our entire social, emotional, political fabric that makes us feel belonging, makes us feel together. And I think, as Sarah's saying, since we've sacrificed so much, we want to get those elements in our life back again. And the expectation is that we will recover those very soon. As we're seeing, as the numbers are ticking, we are doing something right in our own success by maintaining quarantining, social withdrawal, wearing masks. We are successful in that, but in the process, we're also expecting a return of our investment. And so there's a tension that now is going to exist between the anxiety we saw 8 weeks ago of not knowing what's real and what's not real, whether we fight or we flee. I think the expectations since 8 weeks have been, we've done enough and it's time for us to take our turn. The problem is that the anxiety of fleeing now may turn into the energy of fighting. And I don't mean fighting literally, but I think what we're doing is we're shooting the messenger who is saying we have to do this slowly, methodically, one step at a time, where people say in California want to hit the beach running. So I think in terms of the expectations, we've sacrificed a lot. We probably will continue to sacrifice a lot in terms of our social fabric, and need to sort of take a breath and realize this is going to be a very long, slow, we're still in a pandemic process of re-entering the world that we've given up or we've withdrawn from. Thank you.
Thank you. And that's Dr. Russell Fry. He is a clinical psychologist, and he'll be here to answer your questions. Also, email us, plymouthinfo@pactv.org. Today, we welcome back Barry DeBlasio. Barry is the Town of Plymouth Director of Community Resources. That includes our beaches. And Barry, Dr. Fry just talked about hitting the beaches running. So what do you have to say about that?
Well, maybe not running, but walking very slowly and 6 feet apart from the person in front of you is probably more like it. Interestingly enough, I just finished a meeting prior to this one with our town manager, natural resource director, DPW director, chief of police, and that's the discussion that we're having. We're talking about how we can get some of these facilities open. I also spent this weekend on one of the governor's task force for reopening recreation facilities, and some really great information sharing came through. Phase one is it's not going to look like things used to be. There are going to be a lot of restrictions in place. We're still talking about what beaches may be open to the public with staff and with facilities. Normally, or on a traditional Memorial Day weekend, we have staff at Plymouth Beach and we also have it at Morton Park. There are some restrictions. Parking. The governor will probably allow. This isn't. This is still in discussion and it's still in a draft form. But we're looking at parking restrictions up to 50% of what the parking lot capacity would be. And, there are other challenges, such as one-way entries and exits to all of the areas that you'd be going to. Bathrooms, a real challenge in order to be able to do it safely. So there are a lot of things that we're still working on. We hope to have some information this week. This summer we'll start off a little slow, but we'll have staff there and our goal is to do it as safely, and as economically as we can for the town and make sure that everyone enjoys getting out there, but bring your mask.
Barry DeBlasio, he is the Director of Community Resources for the town of Plymouth, and he'll be staying with us during our question and answer portion of our presentation. Each day we do have a representative from the business community to talk about the economics of the COVID-19 response. Today we're joined for the first time by Bob Nolet. Bob is the Director of Operations from the Plymouth Area Chamber of Commerce. Welcome, Bob.
Hi, Steve. Thanks for having me.
And Bob, please tell us how the Chamber is responding.
Sure. So as Amy is updated weekly, we have our COVID-19 toolbox on our website. It's on our homepage, plymouthchamber.com. There is a slew of up-to-date resources available right on that site for the public to view. We really encourage you to check that out because all the information on there has been vetted. So we know that it's accurate and we are updating it constantly. One thing I'd like to mention, over this weekend, we had our Coachella event. It was a huge success. All the proceeds from that event go towards the Plymouth One Fund. Now, the Plymouth One Fund was created to support local Plymouth businesses, and we are thrilled with the amount that we were able to capture at that event. So currently, we have raised $61,483 for the Plymouth One Fund through our Coachella event, as well as just sponsors and donors from actually all across the country. On Saturday, I was actually able to talk to some of the donors, and I was talking to people from the Midwest as well as California that were watching Coachella that had a soft spot for Plymouth. They just grew up here, or they have family here, and they wanted to donate to help local Plymouth businesses. So we were able to team up with Mask for Meds and create the Plymouth One Fund. And that's going to be a huge resource for local businesses as we move forward, because they will be able to apply for this fund and help with whether it be keep the electricity on, food costs, getting up and running, rent help and assistance. And this fund is a legacy fund. This isn't going away. It's not just for now. We hope that this fund is here 30, 60, 100 years from now. So we're in the very early stages of it, but we have a great chunk of change already from the generosity of our local community. And we're going to be able to help a lot of businesses very soon.
That's Bob Nolet. He is the Director of Operations for the Plymouth Area Chamber of Commerce. We're providing this presentation each day so that you can receive verified local information from officials and experts in the areas that are responding to the COVID-19 pandemic. This time, each day, we also welcome Matthew Muratore. He is the Plymouth State Representative. Welcome, Matt.
Hey, good afternoon, Steve. Good afternoon, panelists. Great job from the Chamber, by the way. It was a great event. Glad to hear so much money is being raised for local businesses. We're so blessed to have such an active and involved Chamber in our community. And great job to Bob and Amy and the team. So thank you so much for that. Always comforting to hear Dr. Fry and Sarah and really put things in perspective and give us a real reality check of where we're at. And we are okay. We are okay.
Okay.
I love hearing that from all of you. I chuckled when I heard Barry talk about wearing the mask on the beach. I usually wear sunglasses when I'm on the beach, and I get this little tan, that I take them off, and I get these white squirrel eyes. Now I'm going to have the mask and this. Can you picture that? I don't know how that's going to look. But I'm glad you were able, Barry, to get on to the advisory panel and get some draft form in there. They have been meeting with thousands and thousands of people through Zoom. So, as you said, we will get some guidelines out this week that will talk about for all businesses in all areas on what is going to be needed to open up safely. And you're going to have to meet so many different guidelines. And we've talked about those before, whether it's if you don't have, good cleaning supplies or gloves or masks or thermometers, now is the time to start doing that to adhere to some of these guidelines that are coming out. One of the things that did come out over the weekend too on the golfing, golfing was a big thing over the last 6 to 8 weeks as a legislator that we would hear a lot about. People didn't understand why they couldn't open up golf courses. Well, now that they're open, now what we heard was that golf carts cannot be used on golf courses. And those who are disabled took issue with that, and it was just an oversight. There was some, yesterday morning, they came out with some definitions of those who are handicapped or disabled can actually use golf carts on the golf courses. So that has been corrected. So let's look at some numbers. The numbers are starting to look real good. So hopefully we are on track for a week from today for these guidelines to come out and start slowly opening up the economy. We've had since the last 3 days, we've had an increase of 36,757 tests. And that's now 389,000 tests have been conducted in the Commonwealth. That's 5.5% of the population. The weekend testing went like this. It went on Friday was 14,391. On Saturday was 16,514. And yesterday there were 11,852. Yesterday we had total new cases of 1,050. So that was 9% of those tested. And that's the lowest amount we've had in weeks have been confirmed with the COVID-19. So that's, again, numbers are going in the right direction. The confirmed cases to date are 77,793. That's 20% of those that have been tested tested positive. An average age of 53 years old. The highest percentage points that we had was back on April 22nd, which was 34% of those tested had been confirmed with COVID-19. So from 34% on April 22nd down to yesterday at 9%, we are going in the right direction. Unfortunately, with this goes deaths. There's been an increase over the weekend of 427 deaths for a total of 4,979 deaths, or 6.4% of those who have contracted the COVID-19 have unfortunately passed away. There were 139 just yesterday alone. The average age for a death is 82 years old. With and interestingly enough, and I mentioned this the other day too, over the age of 60, 95% of those that have passed away are over the age of 60 years old. And when you add 50 years old in there or older, it's 99% have passed away. So 99%, 50 years and older have passed away from the COVID-19. With regard to Plymouth, Plymouth has 352 cases with 12 deaths. All 12 deaths have been at long-term care facilities. In Plymouth County has 6,382 confirmed cases. That's an increase of 301. And the total amount of deaths is 393. And that's an increase of 29 from over the weekend. With looking at the last 15 days, 13 out of the last 15 days, the numbers of positive cases have been in the teens. So again, it's going in the right direction. So we're very pleased with how these numbers are going. With regard to hospitalizations, we are at 4%. So we've dropped down to 4%. We've dropped the number of those in ICU beds in the Commonwealth to 810. So that's a decrease of 42 beds from Thursday. The total beds, the folks that are in hospitals because of the COVID-19 has dropped by 308 beds over the weekend to 3,128. So again, that the hospitalization has dropped and continues to drop rapidly, which is a good sign. In Southeast Mass, right now the capacity in beds is at 48%. Sorry, 44%, with 11% in ICU, and statewide is 54%. At BID Plymouth, the number of COVID patients are 70, with 6 in the ICU, and South Shore Hospital is at 81, with 15 in the ICU. On April 28th, South Shore Hospital had 128 cases with 22 in the ICU. And again, they're down to 81 now with 15 in the ICU. One of the last things I wanted to bring up is that we've talked in the past on this show about a lot of silver linings that will come out of this. And one of them I mentioned before is telehealth. And just give you some quick numbers. Telehealth prior to this, so from January to April, telehealth visits, that's with physicians, have increased from 506 to 83,000 cases. That's for medical cases, and for behavioral health cases have gone from 517 cases to 22,000 cases. So I think you're going to see telehealth to be part of the fabric of physical and behavioral health as we move forward in our society. And that's the update for today. So one more thing, the governor will be on at 1 o'clock today if anybody's interested in getting an update today too.
Thank you. That's Plymouth Representative Matthew Muratore. He'll be here to answer your questions at plymouthinfo@pactv.org. Tomorrow's lineup, joining Ken, Matt, and me, include Melissa Arrighi. She is the town manager for the town of Plymouth. We'll also be joined by Christopher Smalley. He is from Beth Israel Deaconess. He's the Senior Director of Marketing and Communication. Also, Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Development Foundation. We're now going to go back to our panel for questions. We'll begin with Sarah Cloud, and the same question for Dr. Fried. And Sarah, people who have been staying at home and have been experiencing stress and upset as a result of COVID-19, how do they deal with that if they cannot go to a support group or participate in other gatherings where they might get some type of help from your organization or others?
I think that's a really great question and a challenge. And as Matt had just mentioned, telehealth or virtual meetings have become the silver lining in all of this. Many of the groups are online now and available through video conferencing. AA and NA meetings are now online. People are remarking that they can celebrate recovery and work on the recovery with people all over the world. They're meeting new people and having really great experiences. There's great yoga classes online. There's support groups online. Behavioral health, so talking to a therapist is now available via Zoom or whatever platform the individuals are using. And so I think there's a lot of ways to connect with people, even though we're physically distancing, which is really what we need to do. And we're really seeing how all of these efforts and the sacrifices, as Dr. Fry had mentioned, are really paying off in terms of the numbers. But we still need to really make sure that we're still socially connecting with people. And there's a lot of resources to do that. And I'm happy to share those and make sure they get posted for availability.
Thank you. That's Sarah Cloud. She's the Director of Behavioral Health and Social Work at Beth Israel Deaconess. Dr. Fry, a viewer writes that this weekend there was family dynamics that escalated and resulted in police and court involvement. What can you say to people who are experiencing stress in the home?
Well, sadly, I think there's been an uptick in domestic violence with children and as well as an adult. The violence is really an issue of pent-up emotional energy that needs to be vented somewhere else. We talk about the groups and multimedia and telehealth and all that. I think one of the things that would be inspiring is, rather than waiting around to receive help, is that some folks begin to reach out and help their neighbor. what they can do for their local churches, getting in touch with their clergy, ministers, rabbis, etc., to give the names of some people who need some help from their own particular congregation or their own particular group. I think there's something about taking care of people is very fulfilling rather than waiting around to be taken care of. And again, the code of the day seems to be nothing. Doing nothing is harder than doing something hard. And it's hard to reach out. It's hard to take care of some other people rather than just sitting around waiting for the doors to open. So I think there's a great value in the gift of giving back to the community.
Thank you, Dr. Fry. He's a clinical psychologist, and all the members of the panel are here to answer your questions. PlymouthInfo@pactv.org. Barry DeBlasio, Director of Community Resources. We talked earlier about beaches. Will every beach and park in Plymouth be handled uniformly the same?
No, and you can't, because if we look at Whitehorse, there's no central parking area for one of our busiest beaches, and it's much easier when you have a parking area where everyone enters and you can control it much differently. And so, unfortunately, it'll be a little bit different. We'll be following the state's guidelines uniformly at all of them, but just the logistics side of it, each one's unique. Keep in mind, the 5 that we supervise are Plymouth Beach, Morton Park, Fresh Pond, Hedges Pond, and Whitehorse Beach. So those are the ones that we have staff. And again, as I mentioned, Memorial Day, it's usually just Morton and Plymouth Beach. Some of the guidelines this summer will be challenging about social distancing, especially in the phase 1. And we may not be able to carry them into every beach. So you will see it. And just a quick example is, we're not supposed to be handling material back and forth, and that means tickets, cash, just to pay. So it may look something like resident only in the very beginning. We're still trying to work that through. But it's evolving, and we should have a lot more guidance this week.
Barry DeBlasio, he is the Director of Community Resources for the town of Plymouth. You can watch Coachella replays at pactv.org. Bob Nolet, the Director of Operations for Plymouth Area Chamber of Commerce, you talked about people being able to apply for support as a result of the Plymouth One Fund. How do they do that?
Sure. So right now we're finalizing the grant application for that. We hope to have that available within the next week or 2. So we want to get this money right out to the businesses as soon as possible. So there will be an application process. It'll go through a committee at the chamber, and then it'll be approved very quickly. Like I said, within the next week or 2. All this information is going to be listed at plymouthchamber.com on our Plymouth One Fund page. That's where you can make a donation to the fund, as well as you'll be able to download the grant application, and we'll have a whole slew of questions and answers about the application. Do I qualify? What do I have to show? What I have to submit with the application? So that'll all be uploaded on our website within the coming week or 2.
And that's Bob Nolet. He is the Director of Operations for the Plymouth Area Chamber of Commerce. We're now going to Representative Matthew Muratore. Matt, last Wednesday, the governor's order was implemented regarding wearing masks statewide. A viewer notes that at the federal level, there are inconsistencies with guidelines, with some federal officials not wearing masks when they are acting in their capacity as federal officials. How do we help viewers to understand the difference between what's happening in Massachusetts as compared to what they're seeing and hearing on national TV regarding our federal partners?
Well, I have one rule in my house: we don't watch national news anymore. We really stick to what the governor is saying, and we really stick to what's on this show. And you need to try to keep it as local as possible. Keep it local to Plymouth. Keep it local to Massachusetts. Unfortunately, if any of those federal officials came to Massachusetts and weren't wearing a mask, then they'd be violating the governor's order, and it'll be dealt with. So the governor's been very clear on this, that the physical distancing and the and the wearing the mask have worked. People staying home have worked. And we're going to continue to do that, as Barry indicated, from dealing with the advisory board at the state level. That we're going to be wearing masks for some time to come. We're going to have physical distancing for some time to come. The parking lots that Barry talked about that are going to be half full is to keep people 6 feet apart, and that's still going to continue as we still open. So I would advise people to just follow what's being said on this show and follow what the governor, when he does his press conference, what he's directing people to do, and I think we'll be fine.
Matthew Muratore is the Plymouth State representative. Each day we go back to our panel to get in a closing statement from each of our participants as to what we would like you to remember from today's presentation. We're going to begin with Sarah Cloud, the Director of Behavioral Health and Social Work at Beth Israel Deaconess. Sarah, what should viewers remember?
Hi. So we've been really cooped up for what feels like a very long period of time, and the weather is getting warmer, and there's been a lot of talk today about beaches opening up and tan lines on your face, and I think we're all really ready to jump back in and to living our best life. And restrictions such as physical distancing, number of people allowed in the store or on the beach, wearing masks, and having to call in orders ahead of time are all bothersome and sometimes downright annoying. But I really want everyone to kind of take a pause, a deep breath, and consider thinking about these restrictions as things that are being done for me, as opposed to being things that are being done to me. It's a really important reframe that these are things that are being done, whether you agree with them or not. The intention and the science behind it is there to keep people safe and healthy, as opposed to feeling like they're being done to us. And really keeping a close tab on what our expectations and our thoughts are around all this. As Dr. Fry said, reaching out and helping others can be really, really helpful at a time like this, not just for the people that we're helping, but more so even for ourselves, which I know can feel kind of counterintuitive, but it really works. So kindness really goes a long way. We'll get through this together.
Thank you. Sarah Cloud, Director of Behavioral Health and Social Work, Beth Israel Deaconess. We're now going to go to Dr. Russell Fry, clinical psychologist. Russ, what can you add to what's already been explained today?
Well, I think it's been a wonderful presentation, and I think generally the answer is keep on trucking. We're doing it right. The numbers are fine. We'll gradually phase into the sacrifices we've made, but I think we need to restore a deep breath, have some patience, listening to the experts, and we're being successful. So why stop being successful?
Dr. Russell Fry, clinical psychologist from Plymouth. We're now at this time going to go to Barry DeBlasio, Director of Community Resources for the town of Plymouth. Barry, you were with us in the past. You're here again today. We're coming to a busy season now with good weather. What should we remind viewers?
I think they need to be patient. We want the facilities opened as quickly as you do. But I think everyone needs to be prepared that things will not be the same this summer. They will. Things will evolve and change, but the holidays, especially Memorial Day, will not be, from an open space and recreation standpoint, the same that they have been in the past. The word you'll hear a lot is households. You may be allowed to do more things within your household group in public recreation areas. And we really have to be careful of things that are being shared. Be patient when you're waiting in line to go to a bathroom at a park or a facility. Be patient with the gate attendant who, may have to turn you away because even though there are spaces in a parking lot, our guidelines are 50%. And so take a deep breath, get outside. We're all waiting for the good weather. We will be there. We'll keep you informed. And but just know that it will look a little different this summer.
Thank you, Barry DeBlasio, Director of Community Resources for the town of Plymouth. Again, now we're joined by Bob Nolet. Bob, this is your first time with us as the Director of Operations, Plymouth Area Chamber of Commerce. What can we say at this time to help our viewers?
Sure. Just a reminder that the Plymouth Chamber is there to help all businesses. We're there to help the community. Please reach out to us. We are accessible via phone, via our email. You can access it through our website. We have a lot of resources and we have a lot of connections within the business community that we can, share with you, and we will help you connect to a specific business or resource. We have everything listed again on our COVID-19 toolbox on our website, which I can't stress enough to go and visit if you need more information. All the town information is on there as well. And as we move forward, when new guidelines come out and restrictions and whatnot come into place as we reopen, all of that will be available on that website as well, on that webpage, right on our homepage. So again, the Plymouth Chamber, we're here to help support local businesses, and we are accessible at any time. So please don't hesitate to reach out. And our website is plymouthchamber.com.
And that's Bob Nolet, Director of Operations, Plymouth Area Chamber of Commerce. Each day we circle back to Representative Matthew Muratore for a closing statement. Matt?
Yeah, hi, Steve. And before I do that, as I said, the governor's coming on at 1. So if you'd allow me a couple of minutes, we just got sent to us some of his talking points. And it's going to talk about what Barry was just talking about. And I'm just going to read it if I may, because I'm just getting it now. But he's going to talk about mandatory safety standards for workplaces with phase 1 of reopening. And there are 4 categories: social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. Under social distancing, all persons, including employees, customers, and vendors, should remain at least 6 feet apart to the greatest extent possible, both inside and outside workplaces. Establish protocols to ensure that employees can practice adequate social distancing. Provide signage for safe social distancing. Require face covering or mask for all employees. Hygiene protocols will include providing hand washing capabilities throughout the workplace. Ensure frequent hand washing by employees and adequate supplies to do so. And provide regular sanitation of high touch areas such as workstations, equipment, screens, doorknobs, restrooms throughout work sites. Under staffing and operation, provide training for employees regarding the social distancing and hygiene protocols. Employees who are displaying COVID-19-like symptoms do not report to work. Establish a plan for employees getting ill from COVID-19 at work and return to work plan. And under cleaning and disinfecting, establish and maintain cleaning protocols specific to the business. When an active employee is diagnosed with COVID-19, cleaning and disinfecting must be performed, and disinfection of all common surfaces must take place and intervals appropriate to the said workplace. So this is going to be coming out at 1 o'clock today, which will start the reopening process of Massachusetts with businesses, and some more to come on that. Not much is different than what we've been talking about for the last couple of weeks, but at least it's going to be in writing now, and we'll start seeing some action on this. So with that said, I think the panelists all said it very well today. What we continue to need to do, we're getting there. We need to continue to stay informed. Thank you for that question from a viewer. Stay informed, and I probably should say this every day. Stay informed locally, and stay informed by listening to the governor. You can go to the mass.gov/COVID-19 website to get all the latest updates. You can call 211, which is a state line that you can get questions answered. You can get alerts by texting COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777. And if you have questions on your health, you can go to bowie.com/mass. Stay calm, stay home. You're saving lives by staying home. And, again, thank you to all those essential workers that are out there taking care of our physical health, and all those that are taking care of our economic health. And as I say every day, the more we come together by staying apart, the quicker we'll get back to the people we love and the things we love to do. Thanks again, Steve, and to PAC TV, and we will talk to you tomorrow.
Thank you, and that's Plymouth State Representative Matthew Muratore. And tomorrow we'll be joined by Melissa Arrighi, our Plymouth Town Manager, also Stephen Cole from the Plymouth Regional Economic Development Foundation, Christopher Smalley from Beth Israel Deaconess in Plymouth, and Matt and Ken will be here each day. And we now go back to Ken. Kenneth Tavares, Chair of the Plymouth Board of Selectmen. Ken, how about your closing statement?
Thank you, Steve. Today, I'm taking quite a bit away from this great group of panelists, and that is the words, things will be different. And I think we're all beginning to understand that. when this started back in March, I think there was a general feeling that, by July 1, this is going to be over and done with, and we can move on and life will return to its normalcy. I think we're understanding that more and more that it isn't going to happen. But we have the will and the desire to do it. We can certainly make things better. And I actually got inspiration for this weekend watching the Chamber fundraiser. When the program opened with our students from Plymouth North and South, I said, that's it. That's why we're doing it. We're going to preserve this generation that we're in now and those that are going to come. Good things are going to happen. We're going to have to be patient. It's going to take time and it's going to take some sacrifice, but it will happen. Thank you.
Thank you. And that's Kenneth Tavares, Chair of the Plymouth Board of Selectmen. We'd like to thank all of our participants today. They include Russell Fry, he is a clinical psychologist, Sarah Cloud, the Director of Behavioral Health and Social Work at Beth Israel Deaconess, Barry DeBlasio, Director of Community Resources, Bob Nolet, the Director of Operations for the Plymouth Area Chamber of Commerce, Kenneth Tavares, Matthew Muratore, and I will continue to be with you each day this week until Friday. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us.